So if you only learn one thing about spine health and about getting rid of low back pain, or if you don't have low back pain, never having it, this is the one thing you gotta pay attention to. It's what we call a neutral spine. But another way to say it is just good posture. So if you think back to maybe when you were in grade school and when your teacher, or your mom, or your grandmom said was sit up straight. It's not that far away from what I'm gonna teach you. So sitting up straight is essentially keeping your spine in neutral, but I'm going to give you a little extra tool that you can use to objectively measure if your spine is in neutral or if your spine is in good posture. So good posture is if you have a pole at home, so this can be a broom pole, it can be a wooden doll, it could be, you can go get a piece of PVC at Home Depot for less than $2. And that pole, if you were to put it on your back, it would touch in 3 spots. It would touch in your tailbone, so that's bone at the bottom of your spine. It would touch in between your shoulder blades, so in between your scapula or your mid-back, and then it would touch the back of your head. And if you're touching in those 3 spots, and the space between this pole and your low back, kind of where your belt is the width of your hand, then you're in neutral spine. So this is good posture. This is where you want to spend most of your day. You're never going to spend 100% of your time in neutral spine, but the more time you spend in good posture, the less time you're going to spend in physical therapy and chiropractic and other more serious type interventions. So how do we do this? It's usually pretty easy for someone to do this just in static position. So static just means you're not moving. So I can kind of figure this out. Okay, this is really good. I'm in neutral spine, good. And then if I take this pole away, then I should be able to maintain this position throughout the day. Now what I tell my patients is you need to be able to maintain that in all activities that you're doing, including sitting, bending down, gardening, picking things up. If I have a freeze gun and I followed you around all day and I froze you, if I walked up behind you and put this on your back, that's where your spine should be. So practicing this is really important. Just kind of being aware of like, okay, this is where it should be. That's better than nothing, but practicing it with a hip hinge is really important. So you've got to be able, in order to have a neutral spine with movement, you've got to practice moving your hips and your knees. So a forward bend, bending forward like this, a hip hinge, there's lots of things that this is called, but you should be able to maintain that position, the 3 points of contact, and then as I get down here, I'll feel this in my hamstrings. And then come back up. What most people do is instead of bending out of their hips, they'll bend out of their spine. So that's what this looks like. So from here, you'll get to here, maybe your hips are tight, and then you'll bend out of your back. And then you'll see that pole will come off your tailbone. That's the most common error that we see. So this is just practice. So what I say is, this is kind of like brushing your teeth. So you get up in the morning, you brush your teeth, you go to bed at night, you brush your teeth, you get that into a routine. You should be doing the same thing with your spine. Your spine, I could argue, is more important than your teeth. If you lose all your teeth, we can just give you new ones. If you lose your spine, no bueno, right? So you have to practice this, and to learn a new motor pattern usually takes between 3,000 and 5,000 repetitions. So I wouldn't tell you to go home and do that right now, or by the end of the week. I would say do 10, 15, 20 of those, and we have patients that come in, that's what we do. We give them a pole. All right, we're gonna do a hip hinge. Do 15 or 20 of those every time you brush your teeth. And then after the course of a period of time, then you kind of realize like, okay, this is where I'm supposed to hold my spine, this is good posture, this is neutral spine, and now I know how to move with that. I move my hips, my spine stays stable, and I don't have back pain.